Title: Raising Colorectal Cancer in Young Adult and Role of Gut Microbe. Presented by Dr. Farhana Afroz, MD, Microbiology, BMU Phase A Resident. Date: 15/07/25. A colorectal cancer usually begins as small, non-cancerous growths called polyps on inner lining of the colon or rectum. Over time, some polyps may become cancerous. Part 2. Clinical features: carcinoma of the colon typically occurs in patients over 50 years of age and is most common in the 8th decade of life. Tumors of the left side of the colon, which are far more common, usually present with a change in bowel habit or rectal bleeding, while more proximal lesions typically present later, with iron deficiency anemia or a mass. Patients may present for the first time with metastatic disease. Lesions of the flexures may present with vague upper abdominal symptoms for many months before other, more specific symptoms suggestive of colonic disease appear. Part 3. Rising incidence in younger adults. There has been a significant increase in CRC cases among individuals under 50 years of age, a group which previously considered low-risk group. This concerning trend is known as early-onset colorectal cancer, EOCRC. Alarming statistics. According to the American Cancer Society, ACS, from 1995 to 2020, colon cancer rates in adults under 50 rose by about 2% annually. Rectal cancer in the same age group increased by approximately 3% per year. The ACS now recommends starting screening at age 45 rather than 50 for average-risk individuals. Global trend: increases have been documented in North America, Europe, Asia, and Australia, particularly higher in urban, high-income countries, possibly related to westernized diets and environmental factors. Part 4. EOCRC in Asia. Epidemiological study shows increasing incidence in countries such as China, South Korea, Japan, India, and Singapore have been reported raising rates of CRC in individuals under 50. In China, CRC is now among the top 5 most common cancers in individuals aged 20 to 49. South Korea has been a sharp increase, especially in rectal cancer among young adults. CRC often diagnosed at a later stage in young adults due to lack of routine screening in this age group. Part 5. Epidemiological trends in Bangladesh. 1. Silat Meg Osmani Medical College, 2023. Out of 150 newly diagnosed CRC patients, the median age was 54 overall, but just 40 years among the younger subgroup, /50 years. Over 90% presented at advanced T stage,